Hey everybody, it's Professor Wells. We're going to go over Chapter 8 this week over teeth whitening materials and procedures. This is where we get into the making of bleaching trays, which I know you're all excited about. Teeth darken as part of the aging process. Some teeth are discolored from medications or chemicals. Bleaching has become a significant part of many dental practices, and it can be done in office or at home. Extrinsic stains are on the tooth surface and are caused by foods, drinks, poor oral hygiene, tobacco, and antimicrobial mouth rinses such as chlorhexidine. Intrinsic stains are incorporated internally into the tooth structure and may result from a developmental disturbance of the developing teeth, hereditary conditions, or can be related to age. Developmental disturbances can result from trauma to the developing teeth, illness with a high fever, and excessive intake of fluoride and other medications such as tetracycline. On Table 8-1 on page 116, this gives you the type of medications and foods and what color stain it causes. So I would make sure you review that. So how whitening works. The enamel on the tooth crown is composed almost entirely of mineral, 97% by weight, with microscopic spaces between the enamel rods that contain water and organic material. Stains accumulate within these small spaces over time. Whitening occurs when hydrogen peroxide or other whitening material passes through these spaces in the enamel and reaches the dentin, where it releases oxygen-free radicals that oxidize the stains and lighten the color of the dentin. This process is accelerated by the use of low-intensity heat or high-intensity light. Open carious lesions and leaking restorations can allow the whitening agents to penetrate too deeply into the tooth, and pulpal irritation can occur. So I'm not quite sure if you guys heard that right, but when we're bleaching teeth, we're not bleaching the enamel, we're actually bleaching the dentin. The main and most widely used ingredients of whitening products are hydrogen peroxide and carbamide peroxide. Hydrogen peroxide products are available as a liquid or gel in concentrations ranging from 5 to 40%. Carbamide peroxide products are popular for home whitening and are available as liquids or gels in concentrations ranging from 10% to 35%, but some 44% gels are also available now. Carbamide peroxide is a weaker oxidizing agent than hydrogen peroxide, and a 10% carbamide peroxide gel is equivalent to 3.5% hydrogen peroxide. Treatment may be done in the dental office by the dentist and their staff. The dentist may prescribe and dispense whitening materials for the patient to use at home, or the patient may purchase over-the-counter whitening products and use them without professional supervision. Whitening is done in the office for both vital and non-vital teeth. In-office whitening eliminates patient compliance issues and gives the dentist control over the whitening process. When a person has his or her teeth whitened in the dental office, a much stronger hydrogen peroxide solution is used. Power bleaching materials typically are similar to home bleaching materials, but are much stronger. These materials often are coupled with a dental light or laser. Regardless of the strength of the whitening solution, they all can cause chemical burns if they come in contact with the gingival or oral tissues, and a rubber dam or liquid gingival barrier will need to be used. Using the barrier causes dehydration of the teeth and will contribute to sensitivity during the procedure and also make the teeth appear lighter. It typically takes about 2 weeks for the shade to actually stabilize. Home whitening is a popular and cost-effective means of whitening teeth. Prescribed home whitening requires the fabrication of trays, and typically a carbamide peroxide solution is used. Home whitening is typically still used at the conclusion of the in-office power whitening. The in-office whitening results will not last indefinitely, and some individuals may need more treatments depending on the severity of the staining. So what we usually do in the office is we'll do the in-office whitening, and then we will make them custom whitening trays that they can use afterwards for upkeep to make sure that, you know, because every day we collect stain on our teeth. Everything we eat puts stain on our teeth. So They can use the custom trays once or twice a week, 3 times a week, depending. Some patients use it every day, and that's going to help keep their teeth nice and bright. Teeth that have lost their blood supply, for example, a tooth with a root canal, will eventually turn dark. When the pulp of a tooth dies, the necrotic breakdown products of the pulpal tissue or hemoglobin from blood in the pulp escapes into the surrounding dental tubules. Chemicals from these tissues cause intrinsic staining of the dentin and can turn the tooth dark. Whitening of non-vital teeth is isolated to one tooth. Bleaching material is placed inside the pulp chamber through an access where it stays for several days. This is called the walking bleach technique. An internal whitening procedure requires that a seal be established at the base of the endodontic access preparation. This is done to prevent whitening from leaking out. There have been some cases of external root resorption that occurred when the whitening agent activated an inflammatory reaction in the periodontal tissues. Home whitening is a popular and cost-effective means of whitening the teeth, but the treatment interval is much longer compared with in-office treatment. Home whitening is usually 10 to 22% carbamide peroxide. This figure shows teeth with tetracycline stain before home whitening and after home whitening. The informed consent should only be signed by the patient only after potential detriment side effects and limitations of treatment have been presented and all the patient's questions have been answered. It's essential for the patient to be informed of the risks, benefits, and alternatives to whitening. Side effects can include irritation of oral tissues and throat from contact with the gel and hypersensitive teeth. The signature should be witnessed and signed by the dentist or staff member and a copy given to the patient for their records. Over-the-counter products are less caustic materials and do not cause as much sensitivity, and they are far less expensive. The U.S. Food and Drug Administration does not require testing for over-the-counter bleaching and whitening products. Manufacturers are not regulated for these products either. There are 4 basic types of over-the-counter products: whitening strips, paint-on paste, gels applied in stock trays, and rinses. Bleaching is not for everyone, and some patients may be allergic to components of the bleaching material. Sensitive teeth may exacerbate the problem. Sensitivity is usually short-term and can be managed by shortening the whitening time each day and using lower concentrations of whitening agent or stopping the whitening process for a few weeks. Other possible side effects include irritation of the gingiva, mucosa, and throat from excess whitening material coming out of the trays. If patients wear the whitening trays overnight, they may experience some soreness of the muscles of mastication and TMJ. We usually don't recommend that patients wear them overnight. We try to tell them, first thing in the morning while they're getting ready, and then before they leave, they can take it out, or before they go to bed. To prevent sensitivity and complications, cavities should be filled prior to whitening. Whitening trays may be done as a pre-restorative procedure to whiten the teeth before composite bonding procedures, veneers, or porcelain crowns. Patients should wait a couple of weeks after whitening prior to bonding because bonding to newly whitened surfaces will be weaker than if the teeth are allowed to restabilize for a couple weeks. If they have tooth-colored restorations in visible areas of the mouth that match the teeth before whitening, the restorations will appear darker after whitening the teeth because the surrounding tooth structure will be lighter. Non-carious discolorations can be caused by mild fluorosis, hypermineralized spots that occurred during enamel development, or previous carious white spot lesions that have remineralized but are still whiter than the surrounding enamel. So what are some possible adverse outcomes? Care must be taken when performing microabrasion to prevent burns to the soft tissues from the acid. If treatment is too aggressive or too prolonged, so much enamel will be removed that the yellow dentin will show through the thinned enamel and the teeth will look much yellower than before treatment was even started. The pulp may be irritated by penetration of acid or by heat generated if the rubber cup is used with too much pressure and speed. So in summary, cosmetic whitening is a popular aspect of dentistry. Patients need to be advised of potential limitations of treatment and other pros and cons if they're going to provide their informed consent to treatment. So whitening is something, I know some of you guys are wondering, why do we need to learn how to take impressions? Why do I need to learn how to pour a model? Hygienists do this a lot. You'll actually be surprised because we are the ones in charge, basically in charge of selling whitening, because we are, we're cleaning teeth. The patient's got questions. After they get their teeth cleaned, the first thing they want to know, how can I whiten my teeth? So if we have the time in our schedule, if we can take those impressions and at least, give them to the assistant to have them pour it up, we're helping not only the patient get what they want, but we're helping the office be more profitable. So once again, if you guys happen to have any questions for me, my email is hwells14@ivytech.edu.